Good morning and welcome to Bloodworks Northwest. I'm Juan Cotto. I am the Senior Director of Government Affairs, and we are going to go ahead and start the press conference on our blood donor tool. I will invite to the podium our President and CEO, Curt Bailey.
Well, good morning, everybody, and thank you for joining us here at Bloodworks Northwest. My name is Curt Bailey, and I'm the President and CEO of Bloodworks. And this morning, we'd like to offer a few remarks about a new initiative we have for ensuring a safe and reliable blood supply for the Pacific Northwest. Following that, we'll make time for some questions. The blood is an essential component of medicine. And every day, hundreds of patients in the Pacific Northwest need blood in order to live or in order to thrive. And every day, hundreds of our colleagues, coworkers, neighbors, family members, friends walk into a blood center and donate. They make a life-saving gift. But the pandemic has made it far more difficult to ensure that we have an adequate blood supply every day for every patient who needs it. And the public has its role to play in knowing when are we asking them to donate, and when is it most important for them to make their appointment and make their life-saving gift. And so we will be introducing today a means of letting the public know each week what is the status of the blood supply. Well, with that, let me make the first introduction to Dr. Jeff Duchin, who is the Seattle and King County Health Officer. Dr. Duchin.
Hi, everyone. Jeff Duchin, Public Health, Seattle and King County. A low blood supply is dangerous for the health of our community. And the shortage that we have is not only an issue for King County, but throughout our region and really across the United States. We're seeing the worst blood shortage nationally in over a decade, and we're being affected by that regionally as well. And low blood supplies can force hospitals to have to delay major surgeries, including organ transplants. And some of this is due to the fact that during the pandemic, there have been fewer blood drives possible. The number of donations has gone down due to illnesses. There have been weather-related closures due to some of the extreme weather events we've had. There have been staffing limitations due to COVID, and our COVID-19 surges all have played a role in decreasing the number of blood products available locally. And when there's not enough blood available locally, Bloodworks Northwest can't provide hospitals with the blood they request and the blood they need, which forces them to make difficult decisions about who will get a transfusion or a blood product today and who will have to wait. Now, we need to improve our blood supply if we're going to address the backlog of surgeries that our hospitals are experiencing due to the COVID-19 pandemic and the limiting of surgeries to only the most essential. There are many people waiting for surgeries, and those surgeries will, many of them involve the need for blood products. And the types of reasons people need blood are for unexpected emergencies like gastrointestinal bleeding, trauma, an unexpected motor vehicle accident or other injury, complications of childbirth. And 1/3 of our local blood products go to children and adults with cancer and other bleeding disorders. So I want to reassure people that it's safe to donate blood during the pandemic, and COVID-19 safety precautions are in place at donation locations. And there's no wait to donate if you've recently received a COVID-19 vaccination or a booster. Throughout the 2 years of our COVID-19 pandemic, our community has supported one another, and this support has been essential to our response. And now we have an urgent need, again, to step up and roll up our sleeves and to help one another by rejuvenating our regional supply of life-saving blood products. So I'm asking everyone to please donate if you can. Thank you very much.
Thank you, Dr. Duchin. Well, in a sense, every blood donor is a first responder. And we welcome today Chief Harold Scoggins, who is the chief of the Seattle Fire Department and a preeminent first responder. Welcome, Chief.
Thank you. Thank you. Good morning, everyone. My name is Harold Scoggins, Fire Chief of the Seattle Fire Department. And I would like to thank Bloodworks Northwest for all the work that they're doing and really getting the word out to increase the blood supply because it's really needed. You know, as a first responder, this is something that we see every day. Each and every day in the city of Seattle, we go out the door between 250 to 275 times a day for emergencies. Most of those emergencies are medically related. So as you can imagine, we see trauma, we see accidents, we see heart issues, we see all types of issues. And when our blood supply is low, it can impact the care of those patients that we're bringing into the different hospitals around the community. It also can impact the care that we provide out in the field. Many don't know this, but our medics actually carry blood to infuse out in the field so we can have an immediate impact. So my ask to the community is please come out and help, as many of our first responders do, on a consistent basis to give blood to lift up our blood supply. It's critical to the health of our community. It's critical to serving those in need, especially in traumatic times. So thank you, Curt, for allowing me a few minutes to ask the community to come out and help, register with me, come and give a little blood like I plan on doing this morning, so we can all help in this space. It's something that we can all do. So thank you.
Thank you, Chief Scoggins. And let me introduce now Dr. Kirsten Alcorn, who is one of the chief medical officers here at Bloodworks Northwest, to talk in a bit more detail about the state of the blood supply and actions we're taking to inform the public of the state of the blood supply going forward. Dr. Alcorn.
Thank you very much. I'm really excited and happy to be able to speak to this important topic today. We've really been challenged throughout the pandemic with the blood supply, and now that we see hospitals opening up their surgical schedules again, just like Dr. Duchin mentioned, we'll be having even more pressure on the blood supply to supply more and more patients to have surgeries they've been waiting on during multiple cycles of holding back on non-urgent surgeries. So we are really looking forward to being able to supply the public with what they need, but this is, as Curt mentioned, it's dependent on humans coming out to help humans. Blood is an absolutely vital medical resource, and that's the only place it comes from. We really need to support each other and our community to make it happen for all types of patients. We have trauma patients, we have obstetrical patients, we have cancer patients, adults and children, and we really want to make sure everybody gets what they need to live longer and live more healthfully. So we're very excited today to be able to show you this method of keeping everybody informed. We want the public to know, not just when we're in crisis, but about donating blood on a regular basis. The blood is needed not just today and not just tomorrow, but every day for weeks and months all year round. So with that, I'd like to introduce Molly Firth, who is a transfusion recipient and very enthusiastic supporter of our blood donation work. Molly?
So it's nice to be here today. Thank you, Dr. Alcorn. Everyone else has shared that blood saves lives, and you never know when you're going to need blood. When I delivered my daughter in 2016, I experienced a significant postpartum hemorrhage that nobody expected, and I was very fortunate that the hospital was prepared. They had enough blood on hand, and blood transfusions kept me alive. The doctors had enough time to address the underlying problem while they continued to push more and more blood into me. It could have ended very differently. I would not be here today if the hospital had not had enough blood. So because of blood donors, my daughter is being raised by her mom. Because of blood donors, I have the unbelievable pleasure of being able to be her mom and being able to be a mom at all. I want all moms to have the blood on hand to survive situations like mine, because they actually do happen far more than you would expect, and not everyone is as lucky as I was. Bloodworks Northwest is here to provide doctors and hospitals with the blood that they need to save their patients' lives, but it hinges on our community donating blood regularly. Many of us can help make sure that enough blood is here for the rest of us when we need it. Thank you so much.
Thank you, Molly. 1 in 6 Americans will require a transfusion in their lifetime. And literally every few minutes, a patient is transfused in the United States. The need never stops, 365, 24/7. And so Bloodworks is pleased to introduce a weekly report that will explain the status of the blood supply, as shown with the number of open appointments remaining to be filled, and the expected impact on the inventory levels of blood in the Pacific Northwest. Because we know that the public turns out when there's a need. We know that the persons of the Pacific Northwest are generous and committed to their community, and when they realize that the blood supply is low, they answer the call. And so this is Bloodworks Northwest's approach to make that blood supply state or inventory level more transparent so that all of us can give the gift of life. So with that, we can take some questions for any of the panelists here at the press conference today. And then a question for our team. Do we want to review the actual forecast screen, or is that for a separate take?
I was going to ask, if you could explain the forecast and what you're looking at there.
And Dr. Alcorn, do you want to do this?
And it's kind of hard because we need you at the mic, but we'll show, because we got to hear what you're saying.
You can just kind of explain what it is.
Explain what they're looking at.
Okay, so this is our Bloodworks Northwest blood supply forecast, the weekly blood report. This is designed to keep the public informed so they know when blood is needed and when the appointments are most available. We're showing this through a fairly simple bar graph, quite visual, but also easy to describe if we're on radio, for example. On the far left, you'll see a vertical bar, and that shows where the blood supply sits. And what you can see is in red at the bottom, we would call that our emergency inventory level. We move up in supply to critical, alert, and then stable, with today's blood supply marked across there in a dark line. So you can see that we're near the upper end of the critical zone right now. Wouldn't we love to be in the stable blue zone? And then on the right side of this graphic, what you see are bars depicting each week and where the open appointments are. So what you can see is that for the week of February 20th that we're in right now, we have a high fill rate for appointments. But if you look out to the week of March 27th, we are really only about 40 to 50% booked. So there's a lot of appointments open there. Any blood donated in that week would help supply blood throughout the month of April. And we would love to be able to do that. So if you look at this, you'll see the current week and then the 5 upcoming weeks. And we hope that will help people to see both when they're likely to be able to make an appointment and what that supply is going to look like going into the future, to know that that's needed for them to do. So we're thinking this is a nice, quick, at a glance, colorful, and easy to read blood report that we can share publicly on a weekly basis.
When was the last time you were in the stable range?
Probably April of 2020. Yeah. So early in the pandemic, we certainly saw the public come out and continue their donation pattern that kept us in or close to the stable range. And then what we saw, surgeries, those non-urgent surgeries got put off until May of 2020, early in the pandemic. And ever since then, it's been a matter of just trying to keep up. And again, it's not just here for Bloodworks or the Pacific Northwest. It's been across the country. And so this is really important because we can't get support from other parts of the country when they're in the same boat we are. So we,
Has it gotten to the level here where you've actually maybe had some of the hospitals have actually lost somebody because of lack of supply?
we have not heard about patient harm coming directly from this. What it does mean is that there's a lot of medical management to help avoid that. So in terms of our own inventory, we distribute blood from our collections out into the hospital inventories, and our medical staff is on call 24/7, and we've been monitoring those orders all the way down to every single unit of blood that's ordered to go to fill a hospital inventory. At the hospital level, they're doing the same thing to look at it for every single patient. If there's 2 units ordered for a particular patient, for example, can they get by with 1? And so we've really tested those limits, and fortunately, we've been able to treat patients enough to keep them going, but not so little as to cause harm.
How wide of an area does this forecast serve?
Well, we provide almost all the hospitals in Western Washington and Oregon with blood, so it's a pretty big footprint.
Are there any particular types that are needed more?
Yeah, so type O blood is the universal blood type, and that's because it's compatible with everybody. So not only is a little over 40% of the population actually group O and requires group O, that's the only type of blood that's compatible for them, it's also used for all of our emergency patients. So somebody who needs blood, even in the field before coming into the hospital, gets group O. Anybody who needs blood before their own blood type can be tested and known what it is gets group O. So we need closer to 50% of the blood supply to be group O. Any other questions? Okay, well, thank you very much.
Thank you. Any other questions for myself or other panelists today? All right. Well, with that, thank you all for coming and joining us here at Bloodworks Northwest. Every day it takes about 1,000 persons to walk in to a Bloodworks Northwest mobile drive, pop-up center, or donor center so that we can have enough blood collected that day to provide for patients in the days thereafter. So we are excited by the prospect of a new way to inform the public of the need for blood and are very grateful for the support of the public for this life-saving work. Thank you.